and welcome to FIN's 17th Annual African American Prostate Cancer Disparity Summit, and to our second session, Effective Community Awareness, Outreach, and Engagement Strategies. I want to thank you, our audience, for joining us today for the second session. I also want to acknowledge and thank our sponsors for their support. They helped make this program a reality. I'm really excited about today's session. I want to show off some of our activity that we are so proud of. And I want to begin by letting you know that I'm actually a substitute today. I am substituting for Reverend Backus, who was not able to be with us because of deaths in his family. He had to be out of the country. So I am his substitute, and I hope I make him proud. I do want to introduce Reverend Blaine Newberry, who will be the co-moderator of this session with me. Reverend Newberry is Associate Pastor of Exaltation at Edon Tabernacle Baptist Church in Philadelphia. He's a member of FIN Survivor Network, where he is very active. He's highly accomplished in a number of areas, and I invite you to visit his bio on the FIN Summit webpage. I'm pleased and honored to have him with us today as a moderator, and I'm going to have him start this program with a prayer.
Father, we thank you today again for your grace and for your mercy, your peace, love, and your power. But most of all, your wisdom. We thank you for the wisdom planted in Mr. Thomas Farrington. Thank you for his vision. We thank you for his team, Brother Adrian in his absence. We thank you for Meredith. We thank you for Jerry. All of these speakers and the sponsors, and we do indeed thank you for the soul of this session, oh God. So we pray now today that we will learn from one another, respect each other, and at the end of the day, we can all say we've done as you have told us to do. In Jesus' name, let us all say amen.
Amen. Thank you, Reverend Newberry. I want to now introduce Congressman Al Lawson of Florida for remarks. Congressman Lawson was reelected for a third term in November 2020 to Florida's 5th Congressional District. He served the people of Florida for 28 years in the state legislature as a member of the Florida House of Representatives and the Florida Senate. Congressman Lawson is another of the members of the Congressional Black Caucus that have extended their support of FIN's effort in the fight against prostate cancer. And we're so pleased to have Congressman Lawson here today for these remarks.
Prostate cancer is at a crisis level among African American males in Florida, and especially in my district. Black men had the highest prostate cancer incident and death rate of any racial or ethnic group in the United States. I'm pleased to be a part of FIN's 17th Annual African American Prostate Cancer Disparity Summit, where efforts and strategies to raise prostate cancer awareness and education will be presented and discussed. As a member of the Congressional Black Caucus, I'm aware of our ongoing commitment in Washington to support FIN's national effort to address the prostate cancer racial disparity. The caucus has been there with FIN for each of the 16 summits, and we are excited to be a part of the 17th summit. An effective fight against prostate cancer and addressing the needs of Black community has to be weighed as a community level. This is where I am so pleased and excited to help FIN as an active partner in Florida and in my district. On a personal note, I would just like to say that ever since the age of 50, I've had ongoing prostate screening and tests. And for those who are concerned about it, it's not much to it, but it's very important to sustain your life. FIN has partnered with AME churches throughout Florida under the leadership of the Bishop Adam Jefferson Richardson to provide education symposiums and prostate cancer screening. The fight against prostate cancer is challenging. It requires creative approaches and hard work. This is what FIN brings to our communities. I encourage you to join in this effort. Together we can save life. Thank you for attending this summit session.
Black men have the highest prostate cancer incidence and mortality rates of any men in this country. Our theme at FIN is that knowledge is the best defense against prostate cancer. And within that motto, we have established focus cities around the country where we have activities. These activities are on the ground and in person. They are virtual. And we've done this since our founding in 2003. When you have a vision to reach out and change the way people view prostate cancer, it requires a lot of effort. And our strategy to reach the areas where we find the majority of Black people was one of our key strategies. This session will present and review these strategies that have proven effective. We will discuss expanded strategies and programs to meet the increased awareness and support needs within the Black community. Increased prostate cancer diagnosis and delays in early detection and treatment caused by the COVID-19 pandemic requires that we expand these strategies. It requires that we may do more in the coming months than we've actually done in some of the past years. And we think we are ready to undertake these expanded strategies. And I will begin that by really talking about outlining the things that we've done over the years, beginning in 2003, really to lay the foundation for where we are today. You know, it's interesting because when I was diagnosed and treated with prostate cancer, one of the things that I realized was that silence was a norm for the day. And in my first book, released in 2001, I had a chapter, Silence Kills. And one of the things that I outlined in that book was that we have to change the culture within our communities from one of silence to one of awareness to one of knowledge in order to change our plight as it relates to prostate cancer. And we began that by establishing our FIN network in 2003, where we mobilized survivors to educate, shape, and advocate policies to address the prostate cancer racial disparity. And I might say that, that this network has really been our foundation and the underpinning for most of the things that we've been able to do successfully. And you will hear from members of this survivor network today, and I am so proud of them and for the work that they've done over the years. We also looked at community partnerships. And I'm gonna ask our slide to go back to the previous slide, please. We looked at community partnerships. It's very necessary. Even with mobilized network members, we have to have partners on the ground to work with us. And we began our church partnerships in 2009 with the Father's Day rally, which recognized survivors and loved ones during their service with altar prayer. And we began our education programs with these partners with symposiums and webinars beginning in 2003 on a large scale. And so those are some of the things that we did with our community partners. And you would hear today from some of these partners and their experiences working with FIN on some of our programs. In 2018, we looked at a different approach to expand our outreach. Different people learn different ways. And so we decided to begin a program, what we call Daddy's Boys Stage Play. That's the name of the stage play that we launched with Garrett Davis production in 2018. And you will hear from Garrett today. And we took that stage play to 14 cities before we were forced to begin filming episodes in 2019 because of the COVID-19. Most recently, we launched our disparity rally with leaders and patients public service campaign. This is an effort that we really feel very good about. I think the initial results look very, very promising. And we've reached out to leaders, some of our community partners that we worked with before, and to others, some of the congressional leaders, some of our network members, to really raise their voices over radio and social media in order to really expand the awareness. We always see that awareness is important. Now, I've always felt since I wrote my book, The Silence Kills, we have to make people more aware and get them engaged. And so we will spend some time looking at our disparity rally as a first part of this session today. And the way we're going to do that is that we're going to have members who have participated in that rally. We will show some of the words that they're voicing and that are played on the radio and through social media since we began that effort this year. We began that effort this year. The participants for this, the leaders and patients, we have clergy, elected officials, medical professionals, patients, survivors, and caregivers. And we focus it along these areas, Maryland, DC, Virginia, and Philadelphia. This is our initial focus. Our goal is the fin focuses that you saw in the earlier slide across the country. So this is just the beginning, and here are some of the results. We have promoted this campaign with 9 radio stations over the cities and states that I indicated. We've had a number of radio interviews. We've had 400 spots aired for this campaign, and we've reached approximately 1 million people through our radio campaign. And this is based upon the data that the radio provides us with the spots that we've aired with them. From the social media stats, we've reached 106,000. We've had through praise of these programs of 50,000 and total impressions of 140,000. And this is just over 3 months. So this campaign is just beginning. And you can see by looking at these statistics why we are so very excited with this campaign to raise awareness. We believe and we know from experience, once we raise the awareness, we have the opportunity to get people engaged as a member of our network, as community partners, and in other ways. So again, we're excited about this. Now we're going to take a look at some of these public service announcements.
COVID-19 is not the only disease ravaging the Black community. So is prostate cancer, and it is estimated to have a 30% increase in new cases in 2021. Prostate cancer for Black men is the largest racial disparity of any type of major cancer for men or women. In fact, Black men are diagnosed at a rate 76% higher and die at a rate 120% higher than white men. Knowledge is power, and the Prostate Health Education Network provides powerful resources at your fingertips for you and your loved ones. It has led the fight against prostate cancer for Black America since its founding in 2003. I'm Congressman Donald McEachin, representing Virginia's 4th Congressional District, and I urge you and your loved ones to visit prostatehealthed.org for information about early detection, treatments, clinical trials, and more. This can be life-saving.
When my husband James was diagnosed with prostate cancer 9 years ago, this diagnosis came only after my insistence for a prostate biopsy. At the time, he was my boyfriend. After a full year of watching my husband's PSA levels rise, neither my husband nor his urologist felt a biopsy was necessary. Prior to the biopsy, I attended every doctor's appointment with my husband. After the biopsy, I understood even more the importance of a caregiver's consistent involvement in the critical diagnosis of prostate cancer. You see, prostate cancer is a disease that impacts the entire family, which means that knowledge and understanding of the disease is important for everyone. I am Wendy Roberson, and I am pleased to introduce you to the Prostate Health Education Network, FEN, the organization that we use to help us keep abreast of current clinical research, treatment options, clinical trials, and more as my husband and I navigate our prostate cancer journey. If you or your loved one desires information regarding prostate cancer, I encourage you to visit www.prostatehealthed.org for FEN online resources. Make sure your loved one gets tested annually for prostate cancer, which includes checking PSA levels and the digital rectal exam. Most of all, remember that knowledge is your absolute best defense against prostate cancer.
Hey, this is Pastor Waller of the Enon Tabernacle Baptist Church in Philadelphia, Pennsylvania. Did you know that 1 in 6 Black men in our community are going to be diagnosed with prostate cancer? That is 76% more than our white brothers. And in fact, we die at 120% of their death rate. This is a real issue. And I want you to know about Prostate Health Education Network, or FIN, who is leading the fight against prostate cancer in our community. I want to encourage you to go to prostatehealthed.org to get all of the information you need. We don't have to die from this disease, but we must arm ourselves with the knowledge about treatment and trials, the knowledge about early detection, and that it is not a death sentence if you know what to do about it. So I encourage you to connect with Finn and help save a brother's life.
I'm Dr. Arthur Burnett, a prostate cancer specialist. Did you know that prostate cancer is the leading cause of cancer and the second leading cause of cancer deaths for Black men? 1 in every 6 Black men will be diagnosed with prostate cancer, which is a rate that is more than 70% higher than for all other men in the United States. The prostate cancer death rate for Black men is more than twice that for white men, and the prostate cancer racial disparity is the largest for any type of major cancer for men and women. Prostate cancer is a crisis in Black America. Knowledge is the best defense against prostate cancer, and I want to introduce you to the Prostate Health Education Network, or FEN, who has led the fight against prostate cancer for Black Americans since its founding in 2003. FEN provides easy-to-use online educational resources that will help you and your loved ones with what you need to know about early detection, treatments, clinical trials, managing survivorship, and more. Visit prostatehealthed.org for this life-saving information.
At this point, I am going to bring in Reverend Blaine Newberry as a moderator for our partnership discussion about their work with FIN, about the disparity rally, and the things that we have done, the things that we can look forward to doing in the future. Reverend Newberry.
Thank you very much, Tom. I appreciate this great opportunity today. We're pleased to have a few gentlemen with me who will express their positions as community partners with FIN. Reverend Dr. Allen E. Waller, the senior pastor of the E9 Tabernacle Baptist Church, and I might say my pastor, who is indeed a humble community partner. He has participated in a number of educational symposiums and seminars and webinars, participated in Father's Day rally. Also, we hosted the Daddy's Boys stage play, and as you saw, he participated as a leader speaking out in a public service announcement here in Philadelphia. Another prominent partner is the esteemed pastor of the First Baptist Church of South Richmond, Reverend Dr. Dwight Jones. He indeed is a community partner who has established himself as one who will participate in educational symposiums, webinars, and seminars around prostate cancer, has participated in the Father's Day rally, as well as a public service advocate by way of announcements during this time of our campaign. And thirdly, we have the most worshipful Grand Master of the Prince Hall Masons in the state of Pennsylvania, however, stationed in Philadelphia, Mr. Donald Jones, who is a new community partner. who has also established the educational symposium and webinar and participated in the public service announcement campaign, Leaders Speaking Out in Philadelphia. All of our speakers today have been presented with questions to give them the opportunity so that we don't interfere with their time that they are going to speak to us today. The questions that they were asked: number one, how important is it for your church or organization to be actively engaged as a partner with FIN in the fight against prostate cancer in the Black community? Also, what impacts have you seen from your FIN partnership? Thirdly, why is it important for you to participate in the Leaders and Patients Speak Out public service announcement campaign? And finally, what additional areas do you think should be addressed to expand prominent cancer community outreach? Following your responses to these questions, Tom will entertain any of the chat questions that may come through. I see all of you as strategists with a strong sense of uplifting our beloved community, who have committed to embarking on this journey with FIN, building awareness, prevention, intervention, capacity, integrity, commitment, being trustworthy and honest. With that, ladies and gentlemen, I present to you first Reverend Dr. Alan E. Waller, Senior Pastor of the Enon Tabernacle Baptist Church in Philadelphia, followed by Pastor Dwight Jones of First Baptist Church of Richmond, Virginia, and then the Most Worshipful Grand Master, Mr. Donald Jones of Philadelphia, Prince Hall Masons.
Well, Reverend Blaine Newberry, thank you so much for allowing me to be a part of this conversation. I don't know if I am excited about being in this conversation because of the weightiness of this matter, or because of the proximity that it places me with someone that I have admired for quite some time, and that is Reverend Dwight Jones in Richmond, Virginia. So I look forward to seeing and hopefully meeting him. This is a critical subject, and the reason that we have gotten involved on a personal note is watching the integrity with which your journey has helped humanize and normalize the conversation. We at Enon watched you as a survivor, and we learned many lessons about bringing a healthy person to it. We watched the integrity of living through it in front of us and recognizing how many people were afraid of the conversation until you, Reverend Newberry, lived it out in front of us. Secondly, as a church, in the African-American community, there is still a trust level that the community has with the church that they don't have with other institutions, chiefly medical institutions. And so to connect the much needed services of the medical community to our community, the church has to be a conduit. And so this is just another way that we have tried to do that at Enon. During the HIV pandemic and epidemic, we did the same thing. And we have turned as you know, at times we have turned our entire building into a hospital, because net or effort for effort, you can get more Black men to come to church to get services than you could get that same number of Black men to go to the local hospital. And that is because of the role that the community plays, that the church plays in the community. I would also answer what we have seen since being involved with FIN. FIN has outfitted us with the real information. In that commercial that I did, I was learning as I was speaking about how 1 in 6 Black men are going to be impacted by prostate cancer, how we're at a 120% of our white brothers. We learned that because we're connected to the people with the information. What I fundamentally believe is that when America has a cold, the Black community has pneumonia. And that is certainly true for the issue of prostate cancer. The sad reality for us as Black men, it is almost not a if, but when will a brother have to wrestle with the discussion of prostate. And because of where the prostate is located, as Black men, we have a whole lot of folklore and mythology about who we are in that region. And it makes the whole conversation that much more difficult. And therefore, what we have gained by being a part of this is that we have normalized the conversation. We've made it okay to talk about it, okay to get checked, and then made and taken the sting out of the whole conversation. I close with this. The first time that I was checked, the first time that I had a prostate exam, I was 40 years old. And I went to the Urban League. The Urban League was here in Philadelphia, and I saw someone, they had a truck there at the convention center. And the sign said, free digital prostate exam. Now, I was 40 years old. I didn't really understand the language. When I saw digital, I assumed that some sort of electronic, non-invasive procedure was about to happen, akin to a digital thermometer. You know, you to point it at the head and get the reading. So I saw digital, and I said, this is my chance to have it checked without any problem. And so I got into the room, and I'm looking around the room, and I did not see any electronic anything. So finally, the doctor came in, and I said, Doc, I thought this was going to be a digital exam. And he said, it is, these digits. And then after I got through that, I realized that there's no danger in the water, and I recognized the importance of it. And I encourage everyone to get in the conversation. And that's why the church is doing what we're doing.
Amen. Thank you, Pastor. Appreciate it. Pastor Jones.
Yes, sir. Yes, can you hear me?
Yep, we hear you.
Okay. Well, thank you for allowing me to be a part of the session today and to be a part of this panel. Also pleased to be with Dr. Waller and my Philadelphia colleague. I'm a son of Philadelphia, went to Germantown High School, and I left there to come to Richmond right after high school, but I love all things Philadelphia. And my family is in Enon. But I'm happy to be here today to talk about Finn and our relationship and our church's relationship with Finn, and to talk about a sickness or a illness that can be prevented in Black men, and to kind of celebrate Finn's tremendous impact in providing information and keeping the light on this particular prostate cancer issue. We know that men of color are being affected at a higher rate than any other population. And we know that the disparity gap is one that is extremely high. And I believe that with Finn, in partnership with the church and other entities, has the ability to address that particular need. In our church, we've always recognized that we have a compelling directive to have ministry to the whole person, not just to their spirit, but to also their bodies, their health, their well-being. And so from the very beginning of our ministry, we have done blood drives. We have invited doctors who are setting up their practices in the community to come to the church, and we encouraged our members to go to see them, to get information, have to have relationship with them. And when this opportunity with Finn came along, it was just a good fit, a fit that allowed us to be able to put the spotlight on prostate cancer and to help our men have a new degree of comfortability with getting it checked and making sure that we can turn these terrible statistics around. And so we've been in partnership with Finn, and Finn has come to our church. Adrian Backus and Keith Crawford have come. They've supported our men's conferences, and they have been facilitators for many of our men's focus groups. And I would say that the men of our church are very much aware of the prostate cancer danger that we face as Black men. I also believe that we have a great role because we have large numbers of women in our church. And when you can convince the women that it's important, then I believe that you can help the men understand that it's important too, because they have a great influence on our men. But I also am involved in this because of my personal relationship with prostate cancer. For the last 20 years, after having been diagnosed, I've had really intense interest in making sure that others had the same information that I had to make the right decisions, to be able to go and have surgical procedures done, or to watch closely through testing what's going on with the prostate. And I believe that that kind of information arms us to help turn the statistics of prostate cancer around. So I congratulate Finn for the work they do. Thank you for the support that you give those of us who are in the business of making life better for our people. And we hope that we can continue to have this kind of relationship going forward.
Thank you, Pastor Jones. Much appreciated. Mr. Donald Jones.
Thank you, Brother Newberry, for the greeting and the invite. First of all, I want to thank Finn for the invitation to be on this distinguished panel and part of their annual summit. As was mentioned, we're kind of new on board, but Finn is not new to me. I attended a health seminar that Enon is that they had at their church many years ago, almost 10 years ago or more. And I attended several webinars that Finn had. When I went into office in this current position as the Grand Master of Pennsylvania, I had a little focus, just to give you a little story. I had a little focus group, a financial focus group, and it was 10 brothers on that meeting. And what really brought the importance of getting information about prostate awareness to me and to our brothers was, out of those 10 people who are in that meeting, 4 of them had issues with the prostate. And the light just went off. I said, whatever I have to do as an organization, as the head of an organization, I will get involved with Finn. Now, the importance of it is the information that they provide. The website has so much information that it's kind of overwhelming, but it points to Black men in the community. My organization, Prince Old Masons, we have an older clientele. We don't get all the younger brothers like the Greeks do, constantly coming out of college. And so these older brothers don't want to come out. They don't want to come outside due to the whole COVID situation. So to get information to them, we actually took the link that Finn has and put it on our website. We also had a webinar for brothers and sisters back in June, very successful. I want to thank all the members of Finn who participated in that. Ever since that, I've got nothing but questions and questions about Finn, which is good. I told them, just go to the website, find all the information you have, information that pertains to you as a Black man. Now, we all have our primary physicians that we go to, and they give you advice, et cetera, but Finn deals with us. One of the questions that we were asked about for the conference here, for the summit, was about direct impact. I can say for myself, and I saw it, heard it, that when we had our webinar, some of the members of Finn here gave one of the members on the panel and in our webinar direct advice. He was going in for some procedures right then and there. That's impact. That's direct impact that we got from that. Also the sisters, we keep forgetting about them sometimes, but they want to know too. You know, we as Black men tend to be very secretive sometimes with our ailments. You know, we're very macho and we try to deal with everything ourselves. But you still have that wife or girlfriend, that significant other that is noticing things too. And as a part of that webinar, I had quite a few sisters thank me for having that. And I want to continue to keep that relationship going with Finn. His position I'm in is 2 years, but we plan on having more webinars, and we plan on having more information try to get more information that we can give to our brothers and sisters. I've reached out to New Jersey, the Grand Master in New Jersey, very good friend of mine. He approached me about having a health initiative. So via my connections on this line, this angle in the Masonic community, we're going to try to get more involvement with Finn through other sources, other connections in the Black community. I know the Imperial Potentate of the Shriners is a member of Enon. Reverend Waller can attest to that. And I will be talking to him also. The more people we can get to, the more sources we can get to, the more it will help our Black community in general. So I want to thank you for having me on here, and I will thank you for being a part of this seminar and this summit.
Man, thank you. Thank you all very much. Tom, might we have any questions for the chat at this point?
Yes, we do, Reverend Newberry. We have a question to Pastors Jones and Waller. What process did you use for hosting prostate cancer education and testing in your congregations in partnership with medical entities?
I will take that first. Thank you for the question. What we started doing almost 15 years ago is we have a Know Your Numbers campaign. And it is a partnership. We've done it with different hospitals. We started with Einstein and have really moved on to have a relationship with Penn, Chestnut Hill Hospital. But what we did in your Know Your Numbers, we brought the hospital to the church. We turned our entire facility into just a big old hospital. And the point was know your numbers, the pertinent numbers that every Black man should know: your blood pressure, your glucose level, your PSA, your height, your weight, your cholesterol. And so we had that. We provided it in such a way that it was free to everyone. And now, because we've been doing it for some years, we've been able to be involved in some longitudinal studies to test the impact of the role of the church on the health of the community. But it began with a partnership with the hospital. The motivation of the hospital, of course, given our broken medical system, was financial. They will come and do these things looking for sick people. They make their money in finding sick people. That's just the reality of it. But we utilize that truth to help brothers find out and know your numbers. Even if you are a man without a primary care physician, there's certain numbers that you just need to know. How much do you weigh? How tall are you? What is your glucose level? What is your PSA number? What is your HIV status? What is your cholesterol number? And we do that every year, which normalizes the conversation and enabled us to get involved with Finn.
And I would add that knowledge is power, information is power. Mm-hmm. And it's important for us to take this idea off the shelf and put it where men can get it. And so in our church, our men, of course, have their monthly meetings, and they have breakfast fellowships, and then they have conferences every year. And Finn has really been a great partner in making sure that our men get the knowledge that they need and they find the comfortability. I think that's another issue that is important, that men need to be comfortable in having this discussion, and they need to be prodded toward taking action, because it's such an important thing that takes out so many of our men. And so I think that the intentionality of the leadership of the church has got to be to make sure that this gets to the front of the line, that this boils to the top, that we make sure our men get this necessary information and that we put our hand on it to say that this is the right thing to do, that this is something that's extremely important, something that you should be involved with and have knowledge of.
Sure.
Thank you for those responses. We have another question. Please speak to how health ministry can help bring people to faith.
Well, I think that health ministry helps bring people to faith because it reminds people that God is concerned about the whole person. You know, one of the problems of evangelical Christianity in America, as expressed through our white brothers and sisters, is that there's such a heavy emphasis on getting saved and going to heaven that it forgets about the real love of God is that God loves his creation, and the highest part of God's creation is human beings. And God really wants us to have life and that more abundantly, which is not to be distorted by prosperity gospel, but by being healthy and having a good time and enjoying relatedness one to the other. And so we believe that if we change our habits in the church and focus on healthy eating and healthy conversations and make that available and accessible, as Pastor Jones has said, to people, that will help with people seeing the relevance of the church. Often the church feels to too many in the community as a once a week option for spiritual showmanship. But when you get involved in meeting people where they need, they'll see the reality of the necessity of a vibrant faith, a vibrant community that helps you live life.
Yeah, I think that's exactly right. And I just think that we have a responsibility as the church to be partners with God in the well-being of humanity. God's going to do his part. The question is, will we do our part? And our part is to take advantage of all of the information, all of the things that are available to us. If we don't take advantage of them, then we can't turn to God and say, God, you know, you do it all by yourself. We have a responsibility to make sure that we've done our part. And that's a part of the faith walk. The faith walk is to take responsibility for our life and take advantage of the wonderful, wonderful opportunities that we have, such as what we are yet seeing here today within this great information, to take advantage of that as a part of our faith walk.
Thank you both for those answers. There's another question. How do you engage men that may not be connected to your church or organization?
I'll start out with that. I think it's just getting the word out, getting information out, getting involved in health fairs, getting involved in community events, community fairs, where you can hand out that information, put it in their hands and talk to them. Have individuals in the health industry out there with you. We just recently had a children's fair on the grounds of our building where we gave out brochures, health information, related information. We had professionals there to talk to people. They weren't part of our organization. It was a community event in the neighborhood. Everything was free. It was advertised. When they come out, that's the time where you could actually engage with them. We have our websites and all the social media sites. They're good, but they'll keep your attention for a little while. If you don't grab them right away, they're going somewhere else. But face to face, and I know it's kind of difficult in this whole COVID environment, but face to face, putting something in somebody's hands, explaining it to them, I think that helps out a whole lot, in my opinion.
I agree. I agree with that. And I'd add to it, while I mentioned the Know Your Numbers conference that we had, There were many other activities at Know Your Numbers for men who were not necessarily men of faith. When we turned our church into a hospital, we also saved a couple of rooms and turned one room into a barbershop. We turned another room into a game room. So we invited the brothers to come and hang out. And that ended up, you could get your hair cut that day. You could play pinochle that day. You could watch the game that day. And so we tried to create an atmosphere that said, we're not going at you head on with sort of front door evangelism. You know, you got to accept Jesus Christ at the door if you're going to get this help. We created an atmosphere and was a man cave. We also had Dominique Wilkins show up, and periodically we've had other persons from the NFL, from the NBA, persons that brothers would want to meet and or see to just be around the conversation. Dominique Wilkins was connected to our emphasis around diabetes. And so we think that if we change our conversation, that up to and includes, I don't want to downplay the role that Reverend Newberry has played in our church. You know, a lot of health concerns in the Black community amongst men have also to do with comorbidities. And some of you who are looking at him may not be able to see, you know, I'm jealous of him because he's 6'3" and I'm 5'7". And, but he's healthy, and he brought a healthy self to prostate cancer, which and he brought a willingness to be transparent to it and is a survivor. We'd like to think that we have a health initiative that says, let's be healthy around, let's have a healthy lifestyle in terms of eating, and let's allow men to be fully men. And so having not only the Know Your Numbers, but having opportunities to go to the Football Hall of Fame, and having trips that include investing in the community with other organizations, and not in battle with the mosque down the street, or not in battle with the Prince Hall Masons. That opens us up to be a safe place for men who won't feel like a Bible's gonna hit them in the head if they show up.
Right.
Yeah, I would like to say this about Enon's Know Your Numbers program. We have participated in that program a few times, and I had the opportunity to be there for one of those sessions. And in addition to providing information, it is a lot of fun. In fact, I got a chance to shoot pool at that event with some of the brothers in Philadelphia. and I never did win a pool, but it was fun. So it was very effective into bringing people into as Reverend Waller said, bring them into the fold so that they can learn. We do have another question here, a couple more. Curious if anyone has any thoughts on how to recruit more minorities for clinical trials research studies. And before someone address that, and we'll open it up to the panel, I will let this person who submitted the question know that at our session tomorrow, we're going to address that head on, but we'll certainly address that question here today. Has anybody done any work there in terms of recruiting minorities for clinical trials or research studies? Have any thoughts on that?
I actually worked in my former profession before I retired. I worked in several health organizations, hospitals. I'm in the IT industry, and most of the time they got their participants through just advertising within the hospital and the community. And so those type of trials, there's a trust factor involved with that. And we as a community, and I think that's kind of And you could look into more in that in what's going on now with the whole vaccination issues that are happening, the non-vaccinated issues that are happening around the country. There's a trust factor that has to be strengthened within the health community and the Black community. And until you get that trust factor strengthened, I'm trying to find out the correct words for that, then you will get more people to go into the trial and those type of clinical trials, and more of us will go into them. I actually helped set up, I was working for Graduate one time, and then another health company, hospital, and we had to set up all the computers in the room where they're gonna do the trials at. And I had to stand by and just watch, make sure everything was working. And I just happened to, and I noticed that most of the people coming in for trials were not us. And I talked to the coordinator of it and I said, well, what's happening? And they said, why? I said, why aren't we there as the Black community and participants? And the program director said, we did all we can. We put out flyers, we made announcements, we got on radio programs, but we're just not getting the people. And I said, then that was almost 10 years ago. And I'm saying the same thing now. There's that trust factor. Again, I think it's kind of showing up in the lack of vaccinations we're seeing in some of the neighborhoods too.
I would agree with that. And I think that an answer with that is actually those of us who have some level of cachet of trust with the community, we have to participate.
Yeah.
I am presently in a trial around COVID. Some of you would know I tested positive for COVID last year. And then uniquely after 6 months, I still had antibodies. And they were really sort of wondering, why do some people keep antibodies? Why do some people not keep antibodies? Most people, antibodies go away. Well, I was then put in a study where I was testing. I will get my first vaccine next week. I was not vaccinated because I'm anti-vaccine. I was in a trial. They were testing us to understand how long do these antibodies last, and why did they last in some people and lots of them go away after 6 months. And what this study has deduced is that if you have the antibodies, it's like having one good shot and so forth. So they're concluding that those of us who have these antibodies have some level of protection, but it is better to go on and get the rest of the vaccine. I say that to say I have tried to be very public about that because I am a leader in the community. And I think those of us who have some relatedness to the community, we have to talk about it. But also the other entities, white entities need to understand the role of the church, because what they probably will do is use their normal ways of reaching out to people, thinking that that's going to get Black people. Mm-hmm. And the reality is the same way you get suburban whites to do anything, you cannot do that and think Black folk are going to do it. Amen. And so learning how to speak to us and respect the institutions, the faith institutions in the Black community is important. I think often the medical community would rather do without us. And I think they're going to have to learn that if you're really serious about Black people, you're going to have to get serious about dealing with the Black church, the mosque, and our fraternal organizations.
Thank you. Thank you. All right. All right. So, Reverend Newberry, I think that this has been a great session.
Yes.
You know, we've heard about from our partners about how they benefited from some of the work that we're doing, and it's good to my ears to hear those things. You know, we try to make sure that we have very current information and we make it available. And I think as Mr. Don Jones pointed out, you go to our website and we have websites and patient portals. You can get overwhelmed with some of the information. We try to make it simple, but we try to make it complete
Right.
because it's important that that our people have the right information. And also, in addition to that, we do have people that will talk to you and talk to patients as needed. So it's not just the information that you would see on our website. We're always available to talk to people that need additional information or that could benefit from further guidance. We have worked with hundreds of organizations across the country and those focus cities that I pointed out at the beginning. And it's our intent to continue to grow that partnership with the other organizations, to grow and expand the types of things that we're doing, because the job that we have in front of us is very, very important. It's very serious. We're talking about saving lives. And so we work every day to try to determine new and better strategies in addition to what we're doing that can help make an impact. And I want to say to Reverend Waller, to Mr. Jones and Reverend Jones, that we appreciate your partnership and we definitely appreciate your being with us today. So with that, I will turn it over to Reverend Newberry, and we'll move from this session to our next session. Thank you.
You're welcome.
Thank you. Thank you, Pastor Waller and Pastor Jones and Brother Donald Jones for your participation.
My pleasure.
Pleasure.
So what we Reverend Newberry, how we doing? Are you set to bring on our next our network members?
Yes, we are.
All right, all right. It's in your hands, sir.
All right. Thank you. Thank you. Well, we thank God. Thank you, Tom, for that last session. Indeed, having our pastors and the fraternal movement. But now we move into a very important area that's close to my heart. I call this group Boots on the Ground. While we have been deemed survivors, I tell people that I'm not just a survivor, I am a survivor's champion. Someone speaks about prostate cancer, my antennas go up like it was my days of playing basketball and football. And now I'm a champion for prostate cancer, going into the community, in the church, among fraternal and sorority organizations, but more importantly, to the Black family. Today, we have individuals who are on the ground, very expressive in their decorum, very knowledgeable about prostate cancer. I appreciate each one of them, and I'm just awaiting to hear from them. Some I've been in their personal company and others I have not, but as far as I'm concerned, they're all my friends because we exist in the same camp. Today we have Dr. James Roberson, the second survivor, his wife, Mrs. Wendy Roberson, as a caregiver, and we certainly thank her for being on today. Dr. Artie Shelton, survivor, Mr. Ralph Tice, survivor, Mr. A.J. Merriweather from Florida, a survivor, and of course, Mr. Robbie Robertson. We did have the opportunity to forward them the questions that were asked. So I would like to share them before they come on, starting with Dr. Robertson. How many years have you been a prostate cancer survivor? And how many years have you been a member of the FIN network? What are some activities that you have been involved in as a FIN network member? And finally, what impact do you see from your efforts and how have you benefited? We'll start with Dr. Robertson and his wife. Thank you both.
You're welcome. Can you hear me okay?
Yes.
Very good. I want to first say thank you to the FIN organization, Mr. Farrington, for again inviting us back. We've done so many things in conjunction with FIN. We've been recruited since 2014, which is right after the completion of my treatment for prostate cancer. And it has just been an incredible journey. I like your analogy, Reverend Newberry, when you were speaking about us being boots on the ground. We know that Finn is an incredible machinery, which actually tries to get information out to all patients and caregivers and family members of those who suffer with prostate cancer. But we need these boots on the ground like us who are out there just touching families and experiencing things with the church. About 7 years ago, I would say 2014, when I was recruited by Finn, so to speak, a colleague of mine, Dr. Artie Shelton, who will also speak today, came to me and said he heard my testimony that I gave at my church, Reed Temple, here in Washington, D.C. It was at a men's group, and at that time, I wanted to come forward and let them know that I was one of those stories which are not unusual, not atypical, but one that needed to be heard. When I was diagnosed with prostate cancer below the age of 50, I was saying, this can't possibly happen to me. I, like many other Black men, said, my knowledge regarding medicine will dictate the fact that I know that I'm not having a significant problem that needs to be biopsied or that I have something going on. And also my lack of knowledge with regards to my family and knowing how strong it was in my family. So those three things, like many other Black men, felt too young, can't possibly, I'm very knowledgeable, and that the lack of knowledge of my family led me to believe that something was not bad happening in my body. It was my partner at that time, as you see, my wife now, who actually went with me to every appointment and argued, I don't understand why you two doctors are not biopsying him. He's on a medicine for what we call benign prostate hypertrophy, for a large prostate, but his numbers should be decreasing, and they were never abnormal. So again, I have normal labs, I have a normal examination, but there was something not right. She encouraged us to have the biopsy. She convinced both the doctors, myself and my doctor, to do it, and we had a surprise when we were found to be actually stage 3 at that time and have been prostate cancer free since the treatment, thank the Lord. I just want to say that, see, this story is not different from many other men that I see in my practice who say, I don't need to have this done. I don't want to have an examination. When I first started my practice, I remember seeing a gentleman who was about 6'3", 300 pounds, who said, doctor, if you do that examination on me, there's going to be a misunderstanding in this room today. And he did not get that examination because we didn't want any trouble. So we know that Black men are sometimes fearful. And I teach the residents, I say, there's only 2 reasons that a man should not have a prostate examination, a digital examination. The doctor doesn't have a finger, or the man doesn't have a rectum. If those 2 things don't exist, the man needs to have blood tests and digital rectal examination. So I've had the pleasure of working with the Finn Network for the past 7 years through support on a local level, through the church, through my fraternity, through my family, speaking at different things in their behalf. I've participated in public service announcements through them. I've also had a short story in a Massachusetts-based magazine where we talked about prostate cancer in men. I just want to say, and we'll open this, I'll be real short. I just want to say that I hope we get to talk about COVID's impact on prostate cancer and what I'm seeing in the world and in practice, and also disparities related to systemic inequalities that we see so easily in policing because it's violent, but we don't see it in medicine. We have a lot of colleagues who don't treat the Black patient like they do their Caucasian counterparts, and we can address that maybe in Q&A time.
Thank you. Mrs. Robeson?
Well, as my husband said, I just realized something, that we started with Finn just, I think it was right before we got married. So when we first came in and we shared our story, we weren't even, I don't even think we were married at the time. What I have, one of the things that I felt has been so important for me being a part of Finn is being a part of a community. It's a community where I am able to share information and learn so much, not only from these prostate cancer survivors, but their spouses, their caregivers, as well as the many pharmaceutical companies that come and provide presentations for Finn. We have, as you said, we've been with Finn for quite a while, and each and every time we come to Finn and come to the meetings and come to the summits, we learn something new. Not only do we share our information or share our story, but we also learn quite a bit every time we come. So I know there are other questions, so I'm not going to go further, but I would just stop right there for now.
Thank you both for sharing. Dr. Robeson, what fraternity is that?
That's out the first Greek fraternity in 1906. That would be Alpha Phi Alpha.
Yes, sir. Thank you. All right. Dr. Artie Shelton.
Hey, good afternoon. How's everybody doing?
Good.
Great.
Good afternoon. Thanks, Reverend Newberry. I also would like to thank Tom Farrington for the opportunity to participate in today's 17th annual African American Prostate Cancer Disparity. And I appreciate the opportunity to participate as a panelist today. I'm an 18-year prostate cancer survivor and warrior. And let me just say why I feel that as a warrior. I spent 21 years in the Army, and my last military deployment was as the Medical Task Force Commander in combat in Mogadishu, Somalia. After that deployment, I saw more death and dying at wartime than 21 years as a doctor. And I stated, I never want to be in war or combat again. It was just too much. In 2003, I had my annual prostate, cancer screening at Walter Reed Army Medical Center. My urologist stated, he said, Artie, your PSA is within the normal range, but slightly elevated from the previous year. And he recommended a prostate biopsy. And so I said, Dr. McLeod, if it's within the normal range, why would we need to do the biopsy, especially since the PSA is within, the normal range, even though slightly elevated from last year, and the digital rectal exam was normal. He said, Artie, because your uncle died of metastatic prostate cancer, and your father also has prostate issues. And so he said, I think it would be best if we did a biopsy. And so I just said, no problem. I trusted my colleague, and I went ahead and did the biopsy. Unfortunately, 2 weeks later, he called me and said, Artie, you have prostate cancer. I said, Artie, you're back in combat, and this time the killer and the enemy is within. And I subsequently had a radical prostatectomy 18 years ago. And so I really feel fortunate that of his astuteness, and that I also feel fortunate that was a time that Tom Farrington, was the founder of FEN in 2003, when I was diagnosed. And Tom and FEN helped me through a very difficult time in my life at that time, as far as to teach me and other men, with prostate cancer and educate them and to mobilize the Black prostate cancer survivors about this disease, and also to help eliminate the racial disparity, from the prostate cancer. So I'm an 18-year prostate cancer survivor.
Thank you so much, Dr. Artie, and thank you for the time that you gave me much encouragement through my process as well. Mr. Ralph Tice, another survivor, is going to speak with us.
Good evening, everyone. And first, can you hear me all right?
Yes.
Okay, good evening, afternoon rather. I'm really glad to be here, and I'm really happy to be a part of this forum. Let me just give you a whole rundown of what we do here in Pensacola, Florida. I began having urological issues in 2016, which included something called a TERPS and several other exams. I was diagnosed with prostate cancer in July of 2017 with a Gleason score of 3+3. And at the recommendation of my urologist, I was placed on active surveillance. When I did that for a year and a half or so, and then followed up with finally my Gleason score went to 3+4, and I was offered an opportunity to have either prostate removal using robotic surgery or external radiation. And figuring that I wasn't a very good operation risk, I chose to do the external radiation. And I completed 40 treatments of that. My PSA went from 8 down to now 0.11. So I'm really happy about that. I've been affiliated with FEN for about 3 years. Well, probably I hadn't heard of FEN, but I did get someone sent me an episode of Daddy's Boys, and I watched the first episode of Daddy's Boys, and I've been a champion since then of the whole thing. So I call myself a FEN warrior also. So I've been involved with several seminars with FEN. I'm a member of the AME Church, and we had they gave a presentation to the Sons of Allen on a group, and I enjoyed that. And Dr. Crawford and Dr. Beck and Reverend Backus, I guess, gave us a seminar, and I appreciate that very much. As far as impact, I'm a member of a group called Brothers to Brother here in Pensacola, and what we do, we provide a safe space for men to sit down and talk about issues. We don't lecture, we just sort of we have several members in our group that had removal, members who had cancer return, We've had members like me on active surveillance. We've had members who all over the place whose cancer has returned and metastasized. What we do is we try to provide our men with questions to ask that doctor. Now, we don't do any diagnosing or recommendation other than the fact that you should ask your doctor about this, ask your doctor about that. Our goal here is to just inform men about the right kind of questions to get with your doctor. I find that doctors sometimes don't give you all the options. There aren't any support groups in Pensacola that's truly dedicated to the African American men. There are 2 other groups, and there's about 11 Black men that attend that group, but 7 of those attend both meetings. So we started, since the pandemic, we started our own group called Brother to Brother, and we try to provide men a safe place to ask questions about urological issues, the whole gamut of things. And you can talk and ask questions about anything you like. That's kind of our story here. We have a few members who can talk on any subject you would like.
Amen. Thank you, Brother Tice. It's so important for us to have men's groups where men can come in confidentially and be transparent during such a time as going through prostate cancer, or even just deliberating about what is going on with them and how should they proceed next. So thank you so much. Next, we have Brother AJ Merriweather, who I met in a conference of Caribbean men around prostate cancer. And I must say, meeting Brother AJ, I fell in love with him the first 5 minutes he opened his mouth. It was electrifying. I had never met anybody that excited when I mentioned Finn. So I knew I was in the right place in meeting with and conferring and fellowshipping with Brother AJ. Brother AJ.
Thank you so much for those kind words to the panel, to Tom, to my previous Sons of Allen brother that just came off, Mr. Raff. I'm also St. Stephen's AME, so we got something in common. What I would like to say in my time is all the previous speakers have said everything. I just want to go back, if you allow me a few seconds, to say past, present, and future. The past, I'm a 10-year survivor. Most everyone know my story. Basically, 10-year survivor, been with Finn for 7 years, met Tom back in 2014 at University of Florida, Dr. Odetna, for Global Disparity Conference. And one of the things I can tell you from my experience, it's a long one, but the short version is educate yourself. When I got diagnosed, I didn't know nobody, didn't know anything about it. And one of the things I have learned over the years from being around Finn, being a member for 7 years, is education is the best resource. Through Finn and Tom, I have traveled the country that I never thought I could. You know, for the pastors in Jeremiah 29:11, God knows the plan he has for us, and it's for good and not evil. God knew that he gave me prostate cancer because I wasn't through with the mission. And being a part of networking with Finn and other organizations have given me the platform as a grassroots person to go out and talk about prostate cancer on the grassroots level. Most guys, when you start talking all this technical stuff, you lose them. But when you compare your story and tell them your journey and you keeping it real, that's when you get their attention. The present, with COVID has brought so much destruction. The churches is closed. We're not able to do health fairs, get out, especially in Florida. It's so contagious that you can't even do face to face. But one of the things I have learned through COVID and through Finn partnership, as far as the Daddy Boy Play, we brought it back here in 2019 with Tom help. We brought it to Jacksonville. We brought numerous summits and programs through Greater Grant Memorial. down in St. Augustine. One of the things I want you to take from this message is, what does FIN mean to us on the grassroots? It means a resource. It means material. It means personnel. And how does that apply when we out there on the street? You need someone that you can say, here's a resource center that you can go to. Most time, guys are not going to go to the resource center. So you got to educate yourself with that knowledge to be able to share with them why they should go to the FIN network, why they should get tested. And in the future, closing with this. One of the things, as a member of the American Legion Post 197, I'm in charge of men's health. With FIN help, we was able, before COVID hit, to start a program of watching the webinar every month, bringing veterans in, feeding them dinner, and sitting around at a round table discussing what we seen on the webinar and what is going on with our members. What we're doing today now with partnering with FIN and COVID, I had to resort to partnering with other organizations because we can't get out there. So I like to just say, in order to get our message out, we have to think outside the box sometimes. We have to go where they are. And it means if you have to partner with other organizations like Pro Talk, Mayo, MD Anderson, they are basically partnering with me, and I'm partnering with FIN to bring these other networks together to expand the brand. This is what we are talking about. The brand is FIN. In order to expand the brand, we got to be able to partner with other people, other organizations, to be able to share. FIN is sponsoring our first ever Pro Talk Prostate Walk. They are our major sponsors. What I say to the vet, we calling all veterans to come out. And this is what we need from leaders to be able to partner with others and not fear that they're going to take something from us, but they're going to bring something with us. Thank you, sir, for allowing me to share that moment.
Thank you, AJ. We appreciate everything you said. And we have Mr. Robbie Robertson, another survivor and part of the FIN network.
Thank you.
Wait a minute. Okay.
Can you hear me okay?
Yes, sir.
Okay. Thank you for the message. I would like to say, first of all, that I think it's an incredible message that we're sending to the world. And I feel like I can say that because I've been with Tom from the second day he started, I'd like to say, in terms of creating this message. And when I look back over the time, right now we're in the process of doing our 17th year in terms of the annual support and session that we put on in Washington over the years. I've been to all of those sessions. And when I look at where we were then in relation to where we are now, I can only say thank you, Tom, for all of the work that you've done and put into this. Part of where I am is I'm a prostate cancer survivor that basically participate in terms of our support group organization, in terms of trying to contact as many people as possible to make sure that they're showing up for our meetings bi-weekly, bi-monthly, to make sure that they can get the message that we are also getting from other organizations, just because of the work that Tom and also FIN is doing in terms of reaching out to other organizations and other places that can give us these kinds of messages. The other thing that I want to say is that I'm a prostate cancer survivor. I was originally diagnosed with a 3.5 number in the beginning. And since then, my PSA has risen to a 0.1. And I'm still feeling good about this. This happened some 18 years ago. And I'm at the point that whatever Tom asked for, I go out and attempt to do that or help that process in some kind of a way. And that's basically where I am with my endeavor to be a part of this show today.
Amen. Thank you so much. Thank all of you so much. As you know, we use that term survivor. Survivor is so limiting as far as I'm concerned. As some have said, warrior, and we're actually champions. And in some cases, you don't have to ask us pretty much to do anything. You talk about prostate cancer, we're getting in the fight, and we're going to say what we have to say based upon what we know. And we know that Finn, as AJ said, is the brand. Thank you all so much. Tom, do you have any questions for us?
Yeah, I think there's some questions, but before we get to the questions, I just want to make a few points. Number one, I am a 21-year prostate cancer survivor for the audience. So, I feel like I'm home when I'm with the other survivors and the warriors in this fight against prostate cancer. And it's good to see all of you, and I appreciate you all being with us today. Not only today, but being with us in the field and on the ground. It was good to hear from our partners, and it was, I think we learned a lot. But the thing that I learned early on is to really engage partners effectively. We need a champion within those organizations. If you listen to what Reverend Waller said, Reverend Blaine Newberry is a champion and was a champion within Enon. He was able to make it happen. People followed his lead. And that is so important. Reverend Dwight Jones out of First Baptist in Richmond, he's a survivor. So he was a champion. And we have numerous churches where the pastor is a survivor. And those churches are really active, reaching out to their members and to their communities. And even with the Prince Hall, Mr. Jones, the Grand Master there, talked about seeing the 4 men out of a group of, I think he said 10, that were dealing with prostate cancer or prostate issues. And I know that there were a couple of men there who took the lead. So our network members really are important in leading this organization on the ground. I can't stress that enough. We can identify cities and states as focus cities, but if we don't have the commitment and the leaders on the ground, we can't make it happen. And we have hundreds of members, and we have members every day who are joining us. And we are continuing to grow this. And I can't thank these guys and the other members enough for the work that you do on the ground, because without your support, we would not be able to do the things that we're doing. So that I wanted to say those words so that everybody understood that I'm number one. I'm a member of the network, and these are my brothers. And as Blaine pointed out, we're warriors in the fight, and so we will continue this fight because our job doesn't end. We make progress, but we see more men that need support. I do want to point out that a couple of things. Number one, Dr. Shelton has been with us, as he pointed out, for a number of years. He's been there at all of our summits. He's taken the lead, and he's helped make our summits possible. And he's also done some work with the veterans there. So, Dr. Shelton, you want to point out some of the things that you've done with the Veterans Organization and literally what it is that you are doing now with the veterans.
Yeah, Tom, thank you very much. You mentioned a lot of things that we, as the members of FEN are doing, but I tell you what, it's because of your leadership that we're really 100% behind you and really trying to get your word and the mission and how to take care of the men with the issues, with prostate cancer. So, like I said, we're somewhat indebted to you for your leadership. We mentioned, it's been 18 years. And it was really the FEN Survivor Network when I was diagnosed back in 2003 when you founded the network. And many people say, well, you're a doctor, so why were you concerned or you should have had a lot of information? What I think a lot of people do not understand is that we have hundreds and hundreds of specialties and subspecialties. When I was diagnosed, I was like any other man that with this very stressful information. And so it was Finn that I was able to go to in Utah to help address some of the questions, because many of my doctors, they have not experienced prostate cancer. They may make the diagnosis, but therefore I needed to talk with other men and such as individuals as yourself that to learn, you know, what I need to do. And because of that, I was able to go out under your leadership and also as the FEN Survivor Network to churches and all the educational symposiums. And one of the things that are very powerful, AJ mentioned something, but I tell you what was very powerful when I was diagnosed, I said, why me? And I was going to Walter Reed one day, and I had gone to one of the churches and gave a talk on behalf of FEN. And the gentleman stopped me and said, excuse me, are you Dr. Shelton? I said, yes. He said, I want to thank you. He said, you came to my church 8 months ago and you talked about prostate cancer. He said, I'm finishing my radiation treatment. Had you not come and gave that talk, I probably would not have been diagnosed and they had a curable prostate cancer. And so therefore, to me, I'm saying that was my mission, that I need to be, you know, a leader and go out and continue your message. But Tom, you mentioned some of the things that I'm doing. Last month, I represented FEN at the Omega Sci-Fi virtual community health fair and discussed prostate cancer. Currently, I'm the director for the Veterans Health Council for Vietnam Veterans of America. And because of the summit that we're having now, I was able to publish this in our, what we call the American Vietnam Veterans Weekly Newsletter. This went out to 55,000 members. So therefore, I sent this out to our network about the FEN, you know, summit. And also recently, as you know, Doris Brown, she's the former and 118th president of the National Medical Association for NMA, and she asked me to give a talk next week to represent FEN and talk about prostate cancer. The other thing that we mentioned in talking about the veterans, as you know, the last in-person conference we had at the Washington Hospital Center, I was able, on behalf of you and Adrian, we got the President Roan of the Vietnam Veterans of America to present at the convention. And he spoke on regards to Agent Orange and prostate cancer impacting veterans, and also the impact on African American veterans. Jerry, do you have those slides? Do you have to have that slide, Jerry? Or Meredith? I just wanted to show on the slide here. This is a picture. Can you get the second slide, Jerry? This is John Rowan. He came to our convention at the Washington Convention Center to speak on Agent Orange and the impact of prostate cancer on veterans, and also met with Congressman Greg Meeks. The next slide, please. This is also introduction with Tom Farrington. Next slide. And so, okay, thank you very much, Jerry. After Mr. Rowan spoke, I was able to, we have something called the Vietnam Veterans of America magazine. I was able to get the pictures and the presentation about prostate cancer published in our Vietnam Veterans magazine. It went out to 87,000 members. 87,000 members got the message of the from the convention, and also that magazine goes out to every congressman and senator on the Hill, and also to 100 and something VA hospitals, and also the 300 vet centers. So those are some of the things, and I've been on numerous symposiums on behalf of FEN and also with Daddy Boys, and anything we can do to really support Tom Farrington and FEN. And there's, you know, there are many other things that in regards to, I was on the committee with Governor Hogan, and where I was able to publish information in a chapter on prostate cancer, also for Maryland, for the State Council on Cancer Control.
Thank you. Now I call that a commitment and dedication, and from a true warrior in the fight against prostate cancer. And as Artie has pointed out, he's been with us now how many years, Artie?
2003, about 18 years.
18 years, and he's been a very active member on the ground and with us. And I'm also going to ask Mr. Merriweather to speak a little bit in more detail about some of the things that he's done. You know, when we looked at working with the churches in Florida, I reached out to Mr. Merriweather to come with us and to be our lead speaker and to help us organize things on behalf of Finn. So he's spoken, as he pointed out, at numerous churches in the Florida area, and now I know we're planning a walk with a Pro Talks organization for the 25th there. And not only that, Mr. Merriweather worked with us to bring Daddy's Boys to one of the largest Black churches in Jacksonville, Florida. So, AJ, you want to shed a little bit more light on that?
Thank you, sir. One of the things I would like to say about me and Dr. Shelton is the partnership that we have with Tom. And this is not throwing accolades. This is just keeping it real. One of the things about the veteran organization, me and Tom, we pivot before COVID because the numbers in the community was not what I was hoping that we was getting from our churches. And being a veteran, me and Tom decided to bring the webinar to my local post. Just as we got off the ground good, COVID hit. We had to shut it down and we just now reopened. But one of the things I shared with Tom when I said past, present, and future, how can we grow the brand? I'm always call Finn as a brand because you have to protect the brand, you have to promote the brand, and you have to tell people why to buy the brand. One of the things we are doing with Finn sponsorship for it's called, if you can see it, everybody, it's upside down, but what it says is calling all veterans. And Pro Talk stands for Prostate Research, Outreach, Opinion, and Opportunities. I share with Tom that being that we've been shut down, we got to look for opportunities to partner with other organizations to either promote the programs that's going on, but while we promoting it, Tom, we also letting people know we have a Finn TV, we have a Finn Play, and I think that's what's working with us on the ground because we are partnered with Pro Talk and your organization to calling all veterans for the first ever prostate walk, excuse my French, in the hood. We have it in the hood, and we calling all the veterans, women and men, to come out and support Prostate Walk. Finn has provided the shirts, the resources, the material, and what we hoping by registering people that day is, this is one of the things you can go when you're sitting at home and you don't know who to talk to. You can go to our network, pull up resources, ask questions, and also by partnering with other organizations such as Mayo, UF, Dr. Odetna, the Proton. It's not about who's got a better message. It's about getting your message out in that competitive world, Tom. And that's what being on the grassroots, I like having more information from a variety of sources, because when you make a decision about prostate cancer, let me be honest with you, you're going to get second, third opinion from doctors that you don't know. And when you give information, you want them to know we are legit. We've been here a long time. Do your research, but hopefully you'll come back to us and see that we are the information network for prostate cancer. Thank you, sir.
Thank you. And I just want to say that the Robersons have been with us for 7 years, and they have supported everything that we've asked them to do. In fact, we still haven't done as much as I wanted to do with the caregiver issue. And I'm ready for about the third time gonna commit to change that so that we can really lighten it up. But they are a great team, the great members of our network, and we're so blessed to have you all with us.
Thank you.
Thank you.
Now-
Can I just say,
Yeah, absolutely.
can I just say, Mr. Farrington, you have brought us in as part of the family, and there is absolutely nothing that you wouldn't ask us to do that we would not do for you, because we know how important, as Mr. Merriweather was saying, the brand. And when you gain that kind of respect for a leader, as you know, already being in the military, there's nothing you won't do when you trust that leader. We are the troops on the ground, and being on the ground like this and hand-to-hand combat with some of these difficult cases, as I was saying earlier, we have patients who go see the doctor, and the doctor who is not of the ethnicity will tell them, you don't need to have these things done. You don't need to have biopsy. I had 2 examples that happened within the last month, both of which came to me, and because they would not go to Finn, to the website, I had to be able to translate that information from Finn that's available to me to them, and they both got biopsies. One has cancer, he's going to go to treatment, and the other one is fine. But what's interesting about the one who had the cancer, the doctor of not of his ethnicity said, just get it cut out. Didn't give him any options, didn't talk about different alternatives, different options that he could use, and that's because of lack of knowledge, even though they're urologists. So it's important that we be advocates on the ground level, hand-to-hand combat, teaching our brothers and their caregivers how to be enrolled in Finn and get information that they need.
Thank you.
True. You know, Mr. Farrington, as a caregiver, in the beginning, my husband was extremely private, and he did not want anyone to know what he was going through, with the exception of his mother and 2 of his sisters. Now he has 4 siblings, but he only wanted like 5 siblings, but he only wanted 2 of his siblings and his mom to know. So I felt very alone, and I wasn't able to share with my friends, no one. And so thank goodness I did have Finn to lean on for that. One thing I can tell you, though, is that what Finn did was it helped him. And I think Dr. Shelton was one of the first people that really got my husband to start talking and testifying to what was happening in his life. And as a result of that, we have been, he has shared his story with Finn. He shared it at church. He shared it with the Cancer Support Ministry, which I'm a part of, actually a co-chairperson. He's also shared it even at the marriage ministry. So we have done so many things. Finn has helped him to actually come out of that shell and share this information with people so they will understand the importance of getting tested, the importance of being an advocate for your own health care. As a matter of fact, what is done for us and for other caregivers is that in his sharing his story, I've had so many wives, partners come to me and say, okay, how do I do this? How do I do that? And it's not just prostate cancer, but any other type of chronic disease or anything. We've had many people come to me, and it's really changed their lives. So I applaud you for doing what you're doing, because it has helped us to help so many other people within the Finn organization and even outside the organization. And I also wanted to let you know that Daddy's Boys, let me just tell you what we did. I tricked my family. Well, it's kind of a trick. But I said, please come to this church play. That's all I said. And they said, what's it about? And I said, and I think it was around the holiday time. I can't exactly remember. But I said, just come on out to the church play. So we had like 15 to 20 people. Dr. Shelton, he held the whole row for the whole family, my parents, kids, everybody came. So we go to the play, and it was nobody knew what it was about, but it was very impactful. And we found out 2 weeks ago how impactful it was, because that play, I think, was about I think it might have been longer. I don't know. But it was like 2-3 years ago. Our daughter called us, and she said, hey, when was it? 18. Wow. So our daughter calls us 2 weeks ago, and she says, hey, Mom, I was just telling my friends about that play. And I was telling them some of the things that I learned as a result of going to that play. She remembered some of the songs from the play. She remembered she remembered the basic gist of getting tested and all these things just from the play that she's a teenager. Didn't even want to go.
How about that?
So I just want to let you know how impactful that is to so many, bringing it to the churches in a different way, so that people can be open to hearing the message without getting pounded over the head with it.
Thank you so much. You guys are blessings to us. You're blessings to many other people that you touch. And we're just proud to have you as part of our network. So thank you. Now I want to ask my brother, Robbie Robinson. You know, Robbie and I I have known Robbie before Finn. So we were brothers before Finn. So so he continues to do a lot and lead the flag waving and carrying the flag in Boston. And for our support group that we had here for many years, we kind of not come together during COVID. But Robbie, would you like to say a few words about that group?
Well, yes, knowing that you're the head of it, we know it will come back, but we expect that we will get out there and do whatever we have to do because that message is very, very clear to a core group of men here in the Boston area. So we're just looking at when we get started to really do that and everything.
Right, and I might say that core group of men, they're all now members of the network, so they reach out to their friends and they're reaching out to their churches. They have spread the word, but Robbie has been a real strong part of the Finn Foundation here in Boston that really kind of sprouted out to the areas where you all are, because we started it right here in Boston. So I just want to recognize Robbie and say thank you for that. And I understand, Mr. Tice, did you have another question or point that you'd like to make?
Yes, sir. Well, I want to get my nickel in there too, say how proud we ought to be a part of Finn, and that we are now able to suggest Finn as a resource and have our members as how to get information prior to going to the doctor. We find that a lot of times our guys just don't ask the right questions. We can talk about side effects. You know, like for instance, in my own case, I had the 40 treatments of external radiation, and I found myself being very tired. And I had it early in the morning time. Then I found the afternoon was gone for me. So we didn't recommend it. Well, so I have it in the afternoon, and I could get some things done. So and we invite spouses to our meetings too. Now we are a very young group. We haven't been out here very long, since May, but we invite spouses to come, and because we feel they're an important part of the whole thing. But more importantly, we just have a one-on-one conversation with men and talk about the whole issue, so you can be more informed when you go to your doctor. That's what Brother to Brother is about here in Pensacola.
Thank you, sir. Thank you. And we're looking forward to good things in Pensacola, work with you and your team.
Thank you, sir. We're looking forward to help.
All right, thank you. So now at this, we have one other part of our another section. We're going to talk about Daddy's Boys. So I'm going to introduce Garrett Davis, who is our producer and playwright for Daddy's Boys. But I do want to thank Mr. Newberry for moderating these two sessions. Great job, and we really, really appreciate that.
Thank you.
Daddy's Boys is a play that we worked together with Garrett Davis and Garrett Davis Production to map it around prostate cancer. So he's done a great job. We have a lot of fun working together to try to touch different aspects of prostate cancer and to keep it entertaining. So at this point, I am going to ask Garrett Davis to come on and talk to us about Daddy's Boys.
Thanks a lot, Tom. It is definitely a pleasure to be here. It amazes me when I hear other people talk about how Daddy's Boys has been an inspiration to them. I truly believe that the underlying factor of all human frailty is one's inability to recognize purpose. I get inspiration from you, Tom. You have recognized your purpose of trying to make sure you turn pain into passion and giving knowledge about prostate cancer. And I'm just excited that we are doing something for us by someone that looks like us, and therefore all of us should be a part of trying to spread that message. We put Daddy's Boys together. We were on a big roll on touring the country before COVID hit. And Tom and I said, we got to keep this going. And so we decided to do some televised episodes of Daddy's Boys. And I want to share some clips with you to talk to you about how we, Tom and I, decided to kind of tackle the elephant in the room. We've talked about clinical trials. I've heard some of you make some great comments about clinical trials. And one of the things that it's important to us is that you can't talk about clinical trials without talking about Tuskegee. And so we decided to use the character, in Daddy's Boys, he's got 3 sons. He got a baby boy. He's got baby boy Charles and his, the junior. And Charles is hard-headed, the spoiled one, and he doesn't believe in clinical trials. And so we wanted to create a character that looked like someone that we could identify with, and to take our viewers down the road, because we know there are a lot of people who are a little bit cautious when it comes to clinical trials. So we're going to show you this first clip to show you how we started this off.
Talk about No. Today I came because today we go with me and you and Junior and Uncle Babe. We go with Pops about prostate. Oh yeah. Prostate cancer. Yeah. Let me know how they go. Come on, Chuck. Look, I know you care about Pop's prostate cancer. Listen, man, I'm not with these clinical trials, man. I can't make myself get with it, yo. I mean, I don't trust it. I ain't rocking with it, yo, at all. But Chuck, we family. I mean, and if Pops is going through this, then we're all going through it. We're gonna learn about it so we can do better. Well, I know a few things you need to learn about. Number one, Tuskegee. I don't trust the government, man. I'm not cool with my daddy being a guinea pig or a lab rat for nobody, yo. Chuck, this ain't 1932. This ain't 1971 either, Billy. But guess what? It's only been like 40 years, man. Junior almost 40. And it took him a year to stop the Tuskegee. And Chuck, it is way better now, though. And safer. And listen, the genetic differences between black men and white men, that's why they do these clinical trials. So we can learn better. Brother, come on, Chuck. Hey. I swear, man, if I was to close my eyes and just listen, I swear you was Dr. Marcus Welby or Dookie Howser, or better yet, Heathcliff Huxtable himself. Oh. But you're not, man. Oh, you funny. You funny. Listen, Tuskegee has been way over. Almost 50 years, actually, Chuck. And everything is safer. It's better. It's different, better, Chuck. But I know what's wrong with you. I know what's wrong with you. You mad because Loretta left you for the other brother. And you think we gonna play sorry and be sorry for you. No. What the hell are you talking about? First of all, Loretta ain't leave me. She didn't leave. I told her I needed time to get myself together. That's the first thing.
And so we can see here in this first clip, we want you to be able to use these clips to help educate your intimate family. And so if you have someone in the family that's going to throw those Tuskegee at you, are you able to come back like Billy? Well, if you're not, then you can do like, the couple, you can invite them to come sit and watch this play virtually, and you can see how Billy responds to that to give you another chance to say, yes, Tuskegee did happen, but because of that, things are so much different now. Things are so much better. So once we tackled the elephant in the room, then we wanted to create Pops in a situation where Pops would, how does a family man who's going through cancer still deal with his sons? And so in the second clip, we're going to show you how we did it, and then we'll talk about it after this. Now here's the second clip.
What's up, Billy? Look, Pops, I don't think Chuck is coming. What do you mean he's not coming? Listen, he tripping, man. But look, man, we can just do it without him. Look, I don't want to do it without Charles. And look, I asked for all my sons to be here. These clinical trials, they're very important. So I need everybody here with me. Now, I understand that Punky can't be here because he's on tour. But look, I need y'all to keep him in the loop for me. And let him know I'm proud of him, too. Pops, we got you. We're going to tell Punkin everything going on. But I'm just not sure about Charles right now. What's up with Chuck? What's his deal? Oh, what you mean? Spit it out, Mr. Bean. What's going on with Chuck? Speak up, Billy. Look, Charles is afraid, Pops. Afraid of what? You're afraid of me dying. Nah, not you dying. He just don't trust nothing right now. He think everything is like Tuskegee. He does not trust the government. He owns systemic racism. Look, I can respect the fact that Charles is aware of the atrocities that our people have faced in this country. arguably with our own government involved. Right. But if we're going to move forward as a people, we have to discuss the changes and advances made since then.
You're right.
Absolutely.
You're right, bro.
The key line in that scene was, if we're going to make change. So communication is very, very important. We want you to be able to use these clips when you sit down with family members and friends to show, even though you got one family member who's against clinical trials, even though you've got a father who's dealing with prostate cancer, what's important to him is keeping the whole family engaged as to what's taking place, keeping them engaged in the process. We all know how stressful that can be in terms of, I'm dealing with an issue in my own body, but yet I got to deal outside my body with my family members, whether that be my wife, whether it be my children. It's a lot. And I'm thankful that the Prostate Health Education Network is an outlet so that you do not have to go through this by yourself. One thing about, looking at stuff on film and looking at things on stage, you get to see yourself, you get to see situations. And now, hopefully, when you engage your family and friends with these tools, you can look at things and look at it a little bit differently. Now, let's see how Pops evolves. Even though he's dealing with him, he's still got Charles on his mind. Let's look at the next clip.
Pops, you look a little nervous. Are you okay? Yeah, I'm okay. I am a little bit nervous, though. That's understandable. Where is Chuck? He needs to get here. Look, he'll be here. I know he will. Look, Chuck has come a long way. It's just sometimes Junior, he not like you. He's totally different. Now look, during this time, what I'm going through, I need you to be the one that keep the family together. Don't be the one that divide us, son.
I look at the comments that were made by the husband and wife couple, and the wife said she was thankful for Finn because she felt a little bit alone. Man, use these clips and use these tools of Daddy's Boys to show, even though, we created an atmosphere where Pops is doing it the right way by engaging people. What happens when you don't do that? What happens if you don't have a resource like Finn? One of the gentlemen talked about the brand. It is very, very important. We have to start those conversations. We have to. And one of the things that we're going to show now is how Pops would even bring his sons along in terms of going to the doctor. And so one of the things that I heard, a couple talk about was knowing the right question to ask when you go to the doctor, knowing the right questions. And because a lot of times, let's just be honest, we're fearful and we believe everything that is told to us. And we don't, we don't take it to a second opinion. We just try to deal with stuff on our own. One thing about the Prostate Health Education Network, you should never, ever be alone when it comes to the decisions that you have to make. Technology plays a big, important part of what we're doing now, and we'll show you how technology and medicine all goes together in this next clip.
Hey, sorry we're late, Pops. I'm just glad you made it, son.
Where would you like us to start?
We can start from the beginning. Yeah. I just want to know everything I can know about prostate cancer.
Sure. Well, prostate cancer is a disease in which malignant cancer cells form in the tissue of the prostate. The signs include weak flow of urine or frequent urination.
So my pops told me that he has advanced prostate cancer. Does this mean he's gonna die?
Most men diagnosed with prostate cancer do not die from it. Your father has metastatic prostate cancer, which means cancer has spread outside of the prostate gland. This is a very serious condition.
So, Doc, how did it happen? And what kind of treatment?
Well, your father was diagnosed at this advanced stage because he did not receive regular early detection testing. PSA treatments and digital rectal exams are very important, especially with Black men who are at high risk of prostate cancer.
So what does all this mean, Doc?
Well, we're treating your father on the clinical trials, and we're monitoring him closely.
So what you're saying is y'all gonna experiment with my father with these clinical trials?
No, Charles. Your father is receiving the same care he would receive if he wasn't on the clinical trials. It's called standard of care. He's also receiving additional treatments that we are evaluating to see if it's better than the standard of care.
Okay, well, I've been talking to my friends about clinical trials, so I'm starting to understand them a little bit more. So with this experiment, my father would be the first one to receive this treatment.
You got it. He's also helping us to develop the next generation of prostate cancer treatments, which may help you and your brothers one day. I am recommending that your father get a genetic test. I understand your uncle is a prostate cancer survivor, and there may be a hereditary gene in your family. There are new trials and new clinical treatments for patients with certain gene aberrations. And we need to understand this to understand the next step we need to take for your father.
Well, I have a friend that works at a genetic testing organization, so I'll definitely be in contact with her as well, Doc.
Yeah. Now look. Charles, I know how hard it is for you to come here, man, but I really appreciate you coming, son.
Yeah, Pops, look, man, I'm sorry for how I've been acting, but you gotta understand my point of view. I'm scared, man. I don't want to lose you. We lost moms, and you know, everything with Tuskegee and these experiments, Pops. I don't want nothing to happen to you. That's all.
I get it. No. So you are gonna do the genetic testing, though, right, Pop? Yeah. Okay.
So I want you to just think for 1 minute after seeing that clip. Can you imagine you have children, you have a wife, you go to the doctor and you're by yourself, and you, let's say you ask all those questions, the right question to the doctor, but you are there alone. Now you have to go back home and give that information to your wife or to your children. See how hard that can be? It's so much easier to involve them in the process, whenever you can. If you can involve them in the process, it makes bringing everyone along at the same time. And I think for those who do not have prostate cancer, like Charles, in that instance, and he's not trusting, and he got trust issues, to give him an opportunity to say his piece and to be answered by a doctor, I think that's going to make it much easier for everyone involved. This next clip is when we introduce hereditary prostate cancer, how we introduce that in the scene. Next clip.
Thanks for seeing me.
It's my pleasure. You know that since your brother was diagnosed with prostate cancer a few years ago, I felt it was important for you to get that genetic testing done.
Yeah, right. So are you saying that it does run in our family?
Well, most cancers do not run in families, and those are considered sporadic. When we do see that there are several family members that have a cancer, then it could suggest that there is a familial or a hereditary cancer.
So, what exactly is hereditary cancer?
So that just means that there's a gene that you may get from one of your parents that you inherit that may in fact make it more possible for you to get cancer. That's a hereditary cancer. And sometimes those cancers can actually be more aggressive as well.
So what exactly are you saying?
So Mr. Johnson, your test indicates that you do have a hereditary prostate cancer.
And so again, you can see all of these clips or all of these episodes, by going to the Fin site, and you can pull those clips up. But we wanted to show you how you can use these as tools if you don't feel comfortable, talking about certain things or being able to explain it. You can show these episodes or just part of these clips for a better understanding. I was impressed and very much influenced by Dr. Whaler when I first went to the church and found out about Know Your Numbers. And this next clip was inspired by the first time that I heard about Know Your Numbers. We created a scene dealing with men talking in the barbershop. When, my grandfather used to tell me all the time, plenty of truth is told in a joke. And so, yes, prostate cancer is a very serious issue, but I guess, it was my envision when men get amongst themselves, they kind of let their hair down and they kind of talk about certain things. And this is what I envision of men getting together in a barbershop talking about prostate cancer, inspired by me first finding out about Know Your Numbers. Next clip. That story about that time you went and got your prostate check. Tell about the experience.
Y'all give me a hand. Man, here we go.
Yeah.
All right. So when I go to the doctor, Tells me, Mr. Brown, I need you to get on over the table and put your hands over the table. So I puts my hands down on the table and he said, better yet, get on your elbows. My elbows. So when I get on my elbows, all of a sudden, I heard this loud, yeah, man. All of a sudden, this other hand. And I'm still feeling this little pressure inside. He says, how's that feel? Relax,
John,
take a deep
get
breath.
your hands off of me and cut my hair, man. Oh.
Tell nobody that. We as men gotta take care of our health. Ask y'all a question. Serious question. How many of y'all know y'all numbers? 336. 655. And 2100. And the number of the day is 522.
There we go. I'm playing that.
Play.
I'm gonna play it.
What number you talking about?
Yeah. I ain't talking about them numbers. I'm talking about the numbers that lead up to health. A good health. You know what I'm saying? Like your blood pressure, your BMI, your cholesterol.
So what's your blood pressure number?
180/20.
What's your BMI?
No more than 25.
What is a BMI?
BMI is your body mass index.
Oh,
You know what I'm saying? Right around here.
John got one of them. See,
You don't have a lot of
he got a body mass index, don't you, John?
Listen, man, it's called, you just gotta say it properly, team do.
Who?
Team do.
You got a team do?
Team do.
What's a
Say
team?
it with me. Is that
Team do.
Say it with me. Team do.
Team do.
So the women look at you and desire you, tell them I have a team do.
Oh, I got a team do. I can't wait to use that. What is that? Well, what is it though? What is it?
That French team. That's when your stomach gets bigger than your team.
I'm not getting ready to tell nobody that.
But all jokes aside though, man, you know, your pop's going through prostate cancer and stuff, man. I've been checking out the Prostate Health Education Network.
They got a lot of
they got a lot of information on that.
Yeah,
but,
they do.
Hey, John, I'm gonna go get a physical. How about you, man?
Man, I'm not. Not again.
Come on, John.
Not again.
John. I didn't say go get your prostate checked. We gotta know your numbers.
So I don't have to go
bend over.
I go.
I don't do too much of it.
Again, that was, our way of trying to keep humor and comedy in the episodes, because if you're asking someone to look at, 15, 20 minutes of an episode on prostate cancer, we had to make sure that we added, some humor and comedy in there, and trying to keep it real to our culture, and keeping it real in terms of, we added a storyline, which is very popular, that has gotten a lot of, these episodes that we're doing are averaging between, 70 and 80,000 views per episode. And I understand this last episode that we've got now, episode 9, is about to eclipse 100,000 views. And one of the things that is popular with episodes, in addition to the information on prostate cancer and giving you tools that can educate, is the little love triangle between Charles that everyone can relate to. So we set this up in this particular clip, and this is how it all starts. And we were able to kind of do some different things. We took the crew out on a boat, and so let's let you see it. Next clip.
Time is my money is my time. So every time you see me, I am always on my grind. I want money. 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 I'm always on my grind.
Looking real happy-go-lucky. I am very happy to be here. Listen, it's been a long week, brother. It's Friday. Uncle Baby got us with the boat. Everybody else here. Have you seen them? You should be happy too, Chuck. Man, it's been a long day. So look all serious for. Listen, man, so I'm with Pebbles today. Yeah. She tell me that they're getting a new regional manager over the hospital where she working. Right. And guess who the regional manager is? Who? Loretta James. You mean Lo? Yeah, Bernadette, her sister. So what I'm asking is, why didn't you tell me she was coming into town? Listen, I didn't know she was back in town for good. I didn't know she was taking a job. I thought she was coming through town. That's what she said. Listen. Oh, man. I'm feeling pebbles. But I don't think I'm over Loretta.
And so one of the things that we're very excited about with episodes that are about to be released, once again, we told you that episode 9 is about to eclipse 100,000 views. We're excited about that. We have a partnership with Atlantic and Pacific Studios, where we are filming all the Daddy's Boys episodes at currently. And so this last, well, not the last clip, next to the last clip I'm about to show you, you can see, the difference in what we're doing as we try to take Daddy's Boys to the next level on this next clip.
You know how I'm feeling about Pebbles. I mean, we going steady. But last night, Loretta called me. She was like, I heard what you're doing in the city with your art gallery / club. I'm flying in this week and I want to do dinner. This what I was telling you on the boat. But you don't listen. Hey, man, hold up. Man, listen to me. Listen.
Pebbles, good morning. Man, have a seat.
You wanted to see me?
Yeah, I just wanted to make sure you're okay with the new market manager that you're going to be reporting to.
Yes, I'm good. I mean, she isn't you, but I hear she has all the right credentials. So I'm excited to see what she brings to the table.
Congratulations are in order for a big promotion. Somebody got a big promotion and a big what? You the big dog. You be killing it.
Thank you.
Yes.
You know, I have my eye on this position for a while now.
Right.
And so I'm super excited.
Uh-huh.
And hey, thanks for coming to get me.
Oh, no problem.
Charles said he'd be tied up today.
Yeah, tied up. Yeah, he's busy. Busy. Got the new art gallery and everything like that. So, yeah.
Yes. You know, Charles.
My old girlfriend is coming into town, and she wants to eat dinner with me and meet up.
Listen, I don't care about any of that, okay? If she wants to see you and you want me to be with you, then she can see us. So what is it gonna be?
Hey, baby, Charles.
And so on this last clip I'm about to show you, we think in the future there's a big place for us to do some product placement with our partners. And we started off with incorporating how we use the Fin t-shirts. And we even put the CEO and founder of the Fin Network in an episode, last clip.
Hey, bro, what's going on?
That's all good. How you doing, big bro?
I'm all right.
What you got there?
Yeah, look, Tom Farrington sent the boys, hooked your boy up, sent me and the boys a couple of t-shirts. Like, got one for you.
Man, thank you, bro. But guess what? You don't know Tom Farrington.
What? Who you think hooked me up with my genetics counselor?
Man, if you know Tom Farrington from Finn, I know LeBron James from the LA Lakers.
Cut it out. Look, you want me to get him on the phone?
That's the oldest trick in the world. Man, all you gonna do is hear the phone ring, then this lady gonna come on talking about leave a message. You can miss me with that right there, bro.
See, you one of them old school Negroes. I'm gonna have to show you. Come on over there. Hey, Tom, look. I got the shirt you sent me.
Mr. Farrington, is that really you?
Last time I checked, Uncle Baby, this was me.
Hey, look, I appreciate everything you've been doing, man. Look, I just want to let you know we got the t-shirts and me and the boys gonna wear them out this weekend.
When I founded the Fin Network in 2003 to raise the awareness of prostate cancer, it's always been a dream of mine to have cancer survivors join us in spreading the awareness of Fin around the country.
Well, I think it's safe to say that Tom is definitely realizing that dream, and we're just so proud of with Daddy's Boys to be able to help him to do that and partner with him. You know, some of the info, when you look at a Daddy's Boys episode, you'll see some of the sponsors, you know, their pop-up, you know, brand will come up. Also, we don't have commercials. We call them infomercials. We want to make sure that our infomercials have just as much to do with the episode. It's not a break, you know, to get up and go to the bathroom or anything like that. But when you see an infomercial on the Daddy's Boys program, it's very informative as well. So, you know, lastly, I'm going to let you look at some of the infomercials that are featured throughout our Daddy's Boys programs.
Hello, I'm Dr. PSA, and you may be wondering if Black men should be especially interested in early detection screening. The answer is yes, and this is why. Prostate cancer is the leading cause of cancer among Black men. All African American men are at high risk of being diagnosed and dying from prostate cancer. Approximately 1 out of every 5 will be diagnosed with this disease. Black men are diagnosed at a rate 77% higher than white men and die at a 120% higher rate. This is the largest racial disparity of any type of major cancer for men or women. Prostate cancer can be curable if detected early. Prostate cancer 10-year survival rate, when detected early, is more than 95%. Isn't it time to talk to your doctor about your prostate cancer risk? To learn more, please go to finpsa.com.
Hello, this is Junior, a member of the Daddy's Boys cast. I'm learning a lot about prostate cancer, and I know just like Pops, men facing prostate cancer struggle with questions about what should they do. Well, the Prostate Health Education Network has developed finpath.com to answer your questions and help guide you. If you are newly diagnosed with prostate cancer, facing a reoccurrence, or metastatic disease, use your computer or mobile phone, go to finpath.com. You will get your answers and be able to talk to your doctor about treatment decisions.
Hello, this is Pops. I have advanced prostate cancer and I am exploring clinical trial. However, I am also really concerned about my bones. With advanced prostate cancer, I am at a high risk of my bones becoming weak from the disease and from treatments, and this could lead to fractures. Fractures will really reduce my quality of life. The Prostate Health Education Network has information that helps me better understand my bone health and what I need to do to protect my bones. I urge all men with prostate cancer to do like I am doing and learn about their bone health at bonerisk.org.
Your DNA is responsible for the physical traits that make you, you. But sometimes the DNA you inherited can have negative consequences, like developing cancer. If you have prostate cancer, genetic testing can unlock new information to help you personalize your treatment decisions. At Myriad, our genetic tests can help predict and prevent certain diseases. Your DNA holds the power to help you regain control of your life and protect the ones you love most. Myriad Genetics. Health illuminated.
So, you know, in conclusion, it has been, you know, a privilege and an honor to work with Tom. You know, we really appreciate the work that he is doing. And we just, you know, excited about trying to go to the next level with Daddy's Boys as we, you know, begin to try to, you know, to look at the possibilities of Netflix and Hulu and other platforms to get the message out. And so, Tom, it's been a pleasure. And we're just looking forward to see where you take us next.
Garrett, thank you so much. You know, it's when we first started this, we were not sure where this would lead us. What we saw is that we had great success with our stage play, as we've heard people speak about today. We went to 14 cities with Daddy's Boys as a stage play. And with COVID-19, as Garrett pointed out, we had to find a new way to get it out. And we chose to do it with these film episodes. And now we have gone through episode 9, and we've reached over 600,000 people. That our goal is 1 million by the end of this year, and we will do that. We will find a way to promote to reach 1 million people, and you know, that's quite a milestone because we're touching people. We're touching people obviously that we don't know. And we're helping to educate them and prepare them for in the event that they face prostate cancer, or if they're facing it, we're helping them with clinical trials, genetic testing, or what have you. So, and we have some, as Gary pointed out, we will continue to try to be creative, to look at other ways to use this medium to educate. And so Garrett and his team have done a great job, and first class producer. And we're glad to have you, Garrett. So thank you so much for that presentation. And let's see whether we have a couple of questions here. Okay. All right. I'm told that I should let people know if you want to see all of those episodes and the complete episode, you can go to dadysboys.org. Go to www.dadysboys.org and you will be able to see the 9 episodes that have been released. We will release episode 10. Our plans are to release episode 10 next week following our 3rd session of the summit. So look forward to episode 10. Okay, let me see whether I have any more questions. Okay, so we are, what we've done, thank you, Gary. Thank you so much. And thank the cast for all the good work that they do. So at this point, I'm going to ask Reverend Newberry to come back on as we wrap up the session. And as he's coming back, I do want to remind people that each of these sessions is recorded and available. Session 1, you can go to finsummit.org. You can see the complete session 1 recorded from last week. This session will be recorded certainly within a few days. And so for those of you who may not have seen this episode or all of this episode, not this episode, I'm thinking film now, but this session, again, finsummit.org. So please do that. But next week, we will look at our tools and information for prostate cancer awareness, prostate cancer treatments, and clinical trials. You've heard many people talk about the information that we provide. It is an effort to prepare this information and these tools for our patients. And next week, you will see where we are with the tools and information that we have and get an understanding of where we are planning to go. And I'm going to ask my team to see whether they can bring Mr. Newberry and I up. Let me see with a different view so that we can kind of wrap things up. Reverend Newberry.
I'm here. Yes, sir.
No, it's been a treat working with you on this session. We've covered a lot of grounds. I think people understand our vision for education, for awareness, outreach, and engagement with the community. They've seen the work and heard from our partners, heard from our Survivor Network members, and they've had a chance to hear from Gary Davis and see what we're doing on the film side. You know, one day we might just kind of take this Daddy's Boys all the way to Hollywood. What you think?
We're close. We're close now. Right. We're close.
Do you have any closing remarks, Reverend Newberry?
No, I'm thoroughly excited. I would love to encourage everybody that even though we have expounded on so much today, there's still much more work to do. I know my crowd that I hang with, boots on the ground, we understand, as I think AJ said, we got to go into the hood and really talk to these brothers and these families within our communities because they are suffering even the more because of COVID and now leading to areas of mental health challenges and so forth and so on. But being that I'm a Baptist preacher, I will say thank you, Tom, for the opportunity. Paul talks to the church at Corinth, 1 Corinthians 15, verse 58. He says, be ye steadfast, unmovable, always abounding in the work of the Lord, for as much as you and I know that our labor is not in vain in the Lord. So I'd say, Tom, be encouraged. And for the accolades that come, your humility will carry you further than you know. And you have many of us who admire the great work that you do throughout this country.
Thank you, sir. Thank you so much. And again, thank you for being a part of our team, a big part of our team. And I think together with you and our other team members, that we will continue to make strides in saving lives. I do want to say before I close that you will have a survey opportunity at the end of this session, and we would really appreciate you completing that survey. So at this point, I want to say to Reverend Newberry, I wanted to say to all who have participated in this, thank you so much. You've been great. We've gotten the word out. We've got the word out more. I want to say thank you to our audience for joining us. And I also want to say thanks to our sponsors for supporting us. And with that, I am going to say that we have completed Session 2 of the 17th Annual African American Prostate Cancer Disparity Summit, and we will see you at Session 3 next week. So goodbye.
Thank you. Take care.